Oh, you're live, Senator.
All right, this is Senate Health and Welfare. We're back and we're continuing our morning. We're looking at drafting a letter together to send to our federal delegation. And we're trying, what we'll do is we'll identify some statutory or rules changes at the federal level that will help us at the local level in the states for our healthcare system, cost, quality, access, or for our welfare system, and improving, giving us some opportunities to improve in the states. I did write a letter last year and identified a couple of things that may still be relevant. But I think one of the things that's really clear is how the pandemic has exacerbated or opened up some of the gaps and taught us things about actually workforce. And one of the areas of concern that I continue to have, and I know it's been brought up in Washington, but there's the battle going on about student loans and student loan repayment and student loan forgiveness, and whether or not student loans can be deducted from taxes at federal level, and then is there a pass through the states? So during the pandemic, Jen, help me with this, but I think during the pandemic, employers could let workers, gave workers the authority to deduct their student loan from their state taxes. I think that was in one of the federal laws. I forget which one.
I'm not sure I followed all of that, but I can certainly look into.
Okay, and so, but that we can just say something. We should have some ability in the state, or there should be a federal.
Right. There was forbearance on
That, yeah, forbearance on,
student loans.
what was, how was that? What was the specific?
I believe there was just a moratorium on having to repay,
Okay,
and interest did not accrue.
but there was also something else about employers allowing for somehow employers, because right now, for example, if you work, have your own business, or you're in a business organization, and this is a slight sidetrack, but if you go for a professional development, you can deduct that as part of your business. And I think during, we'll have to find out, but the whole student loan area.
Okay, so you're thinking there was a connection to employer.
There was a connection, but I'm less interested in that and more interested in saying to the federal government, allow for deduction of student loans.
Okay.
And I don't know whether the committee agrees with that or not, but maybe we can look at some language in the letter that might support that. I know it's controversial right now about forgiveness, total forgiveness, but deduction. I see you. What are you thinking?
I have an opinion on that. I think the government needs to get out of the student loan business. These colleges want students to come, they should loan them money.
Oh,
And then if they default on their loan, the school has to deal with it. I mean, they'd be a lot more selective about who they let into school. That's my personal opinion.
Okay.
Pell grants, all of them. And we don't have to fight over who's gonna, if we're gonna give pay for the student loans, forgive them. That's my personal opinion.
That's not my opinion, but we'll just leave it at that.
all right. Well, so what do you think about asking the federal government to what?
Well, I mean,
He wants us to get out. That's
right,
what-
no, I like the way they do it in other countries where college is paid for. I mean,
So
it should
loan
be-
forgiveness is what you're saying.
yes.
Yeah.
That's another form of it.
Okay.
Yeah, we need to be providing education and access to our people.
increase access to education
Absolutely.
by providing loan forgiveness or tuition reimbursement, or putting the burden on colleges. That's a big,
Well, I mean, it's the same thing that you're talking about. If you go to college free in the European countries, right?
More or less.
So
yeah.
government picks up the tab and the colleges do also.
Well, we also
But
need
they're
to,
more selective about who gets into the school too.
It's a lot more hierarchy there.
this is true, and they have a lot more, it seems as though they have a lot more pathways with different opportunities available.
I'd say they have a lot less pathways. You're plugged
you
into
get
a
plugged in
pathway.
right in the beginning.
And then you follow that
I
track.
think, do you mean opportunity? Because that's a path, that is a pathway.
No,
Those are
you
pathways.
test and that determines your
I
future.
know,
Right,
I
and if you're sick
Same.
that day and you do badly, you're,
right, so that's a
Yeah,
little bit of
no,
an, that's a little bit of an exaggeration, but what I'm saying is there's not this binary, you know, that I think we sometimes feel in this country, you go to college or you don't. There are lots of opportunities for internships, for, you know, trade, and in between, there's also a category in between the high university degrees and the trade. They have, you know, they have different kinds of schools for different kinds of needs, and I really appreciate that, and it's paid for more, I mean, for all intents and purposes.
so during the pandemic and last year, we put in place, we had ARPA funds to put in place loan payment monies, workforce retention monies, and incentive funds for folks to go into the trades or into specific areas. So that's a different place. So let's talk first about student loans, and and then come back down to workforce a little bit, because they do intersect.
Right, and is there any part of this where we also ask the universities to keep an eye on their costs? I mean, costs have gone absolutely through the roof exponentially over the years.
What can we ask the federal government? What rules or laws or guidelines?
Endowments, do they need to be sitting on these massive endowments?
Requirements for use of endowments for private institutions, because we don't regulate private institutions.
So just to remind you that this is a letter coming from the Health and Welfare Committee to the
Thank you,
federal
Jen.
government, asking them for certain things that potentially feel like they are hindering your ability to develop policy the way you want to in the health and welfare space. So are there specific things?
So nursing, medicine, all the allied health areas, that those students have significant encumbrances with student loans.
Yeah.
And so what provisions could be provided, what could we see at the federal level that would reduce the burden of those loans on those healthcare workers? Because we know we have a huge workforce crunch in the state. How's that? That's.
I would add to it, staying germane to health and welfare.
Yeah.
The immigration policy leading to, you know, supporting the current workforce shortage. I don't see them addressing it, and this has been going on for quite some time. And I think that our federal delegation needs to be reminded that they have a lever in immigration law that could, you know, very quickly change the character of the workforce problem.
I agree with Senator Weeks.
I do
on that.
too.
Can you
Yeah.
say a little bit more about what it is in order to allow more trained
Well,
medical professionals from other countries into this country? Is that what you're?
yes.
Okay.
Yeah.
And skilled labor.
Well, that's totally different.
Well,
I'm trying to
we
stay
don't
within
do
our,
skilled- we don't do skilled labor, but you're right.
Yeah, but
to Jen's point.
in all in all fairness, welfare, the word welfare
Yeah.
is very
Well, but
broad.
it's the LPNs, you know, the people who are gonna make the beds in the hospital. It is the environmental
workers.
services,
Childcare provider.
childcare providers, yes. So
Educators.
within that whole umbrella of health and welfare.
You pointed back to me about something about the drugs.
Yes,
We were speaking, I think it had to do with the forensic facility.
yeah,
Is that we need a facility, and we need funding for it, where we can actually, something we can build and not take advantage of facilities that are spread out all over the place, in 5 beds and 9 beds. And that's what I was talking about. We need more funding. It's not our fault that, you know, the borders are open and the drugs are coming in and infecting our citizenry. And if they're gonna continue to let them in, not have a firm policy, then they should be paying to help us fix the problem at this level.
so what I'm hearing you say, you're saying a lot of things in that, I know, well, but that because the substance use disorder epidemic is across all states, but in particular border states where we might see greater mobility. I don't know if that's true or not, but that we would want, we believe that the federal government should provide resources
Correct.
to the states, resources for prevention, intervention, treatment, recovery, and then public safety to stop some of the input drugs. Okay.
Just to follow up on Senator Williams's point, I mean, one way to handle the cross-border drug issue would be to decriminalize drugs and to treat addiction as a public health care crisis.
Yes, and
Substance
to
use disorder.
reevaluate some of the Schedule I drugs and have, so that they can be evaluated for how they fit into the whole scheme of drugs. I had a great conversation with the dean of the medical school, one of the deans the other day when he was here, about that very issue. I know you've been concerned about it.
I mean, we've all become border states
Yeah,
because of the product that's coming in here.
yeah.
And we can't stop it.
But I think what Senator Gould is talking about, for example, cannabis is listed as a Schedule I drug. Psilocybin is a Schedule I drug, and yet we begin to see therapeutic uses. So from our perspective, having those drugs evaluated and researched for therapeutic use would be helpful. Because right now it's all under the table. Yeah. Well, not cannabis isn't now.
Right, but the other ones are.
Okay, so that's an FDA issue.
Well,
And then-
we're
So
gonna
did you get
go
anything
there.
out of that?
I'm getting some stuff.
He's getting some stuff. Well, then the other,
Scribbling.
I'm trying to remember all the things yes. So during the pandemic, we received a 6.2% FMAP increase for Medicaid. In other words, we had more Medicaid dollars coming in during the pandemic. And now we're seeing that 6.2% is going to disappear, and it has been extremely helpful for access for patients and for providers. So the question is, how do we heard a couple things. One of my suggestions was A, continue the 6.2%, or B, do we simply say we'd like to see Medicaid reimbursement dollars coming in at Medicare level or at 105% of Medicare? That's been a suggestion that we've had.
That's the reimbursement
Right,
piece, so I think
Right,
what
it's
you're
different.
saying is that we would need more money from the feds to be able to
Right.
enable. I think it sort of goes together, keeps that
Yes.
sort of increased FMAP that would help us to
achieve
boost,
a
Medicaid
Medicare or
reimbursement rates.
105% of Medicare, yeah. That makes sense.
Yeah, absolutely. That's probably the number one comment I get from medical providers is the
It is.
Medicaid reimbursement rate.
Because the independent providers can't survive. And that's why we're seeing so much consolidation. And we're also seeing that That's one. And then we're also seeing that our community services that fall under our Medicaid umbrella are unable to, they're in financial instability as well.
So 105% versus 110%.
I don't know, any percent higher.
Okay,
Is it, you have 110, put it in.
I don't know what's right. I don't have a background in.
Yeah. We'd have to ask.
We don't know what we don't know.
Well, or the other thing is that as we receive funds from the federal government through our global commitment and as Medicare reimbursement takes place from the federal level, over which we don't have control. And as insurance companies are negotiating with providers and making contracts over which we have minimal control about reimbursement. And then some of that happens at the Green Mountain Care Board and at the Department of Financial Regulation. As all of that's happening, there's no escalator in place. In other words, the reimbursement to independent or other private providers doesn't go up on a regular basis. And that's a tough one.
You mean
The federal would be great if the federal government would rely on some inflationary measure to provide increases. Otherwise, we're going to see what we're seeing, what we've seen in the pandemic. What we continue to see is a loss of primary care docs. They're at the low end. We're going to see a loss of clinics. We're going to see a loss of nurses. And so that it all, leads to that.
So I think there's some of this that probably got into the letter from the education committee too, but,
Oh,
you know, the PFAS and the
chemicals.
PCBs, I think we need to reinforce that,
Okay.
you know, Vermont has a tougher standard, has a higher standard for contamination than the federal DEC does.
So, yeah.
That they ought to tighten up, they ought to increase and then increase the funding so we can help to get rid of some of that contamination.
So in our area, the public health implications. So one, beginning at the TSCA level, or, you know, the EPA federal, FDA level, that better, more scrutiny. I don't know whether it's rules or law. Must be law. More scrutiny of chemicals before they are put out into the marketplace, and maintain high standards so that we don't see the increased costs associated with chemicals. Something about the better testing process, and we're not seeing that.
Right.
TSCA, the FDA has been really slow. And we've heard that when you look at your bill and you're looking at your bill, they've been very slow. And it's because there's a lack of, there's a lot of reasons, I guess, but
Yeah, we
Yeah,
don't even,
corporate pressure.
we don't even know, you know, the effects of what we're finding now
Yes,
are gonna be 5 years from now.
right.
So there could be potentially a health risk.
Maybe it's a reevaluation of who tests and how frequently those chemicals are tested. We have a very rigorous prescription drug testing program through that, but we don't have a very rigorous testing program for chemicals in consumer products. Because we'd like to see some changes to that.
Can I just follow up with on what Senator Williams said? I mean, in terms of like seeing public health outcomes, those in PCBs at least, they've been around for 30, well, more than that. They've been around a long time, so we would be seeing the effects of those now, and maybe are seeing the effects of those now. But to Senator's point, can we, in our other letter to our federal delegation, we did make an ask for some financial assistance around, you know, especially around the educational piece, the school building piece, cleanup for chemicals, but also construction, et cetera, et cetera. Can we sort of make
You
that
want to
kind of an
dovetail
ask?
on that?
Yeah.
Yeah, I mean, we
Okay.
reinforce what you
Okay.
said, that'd be great.
So
Yeah.
there is a letter from education.
Yes.
Yep.
Yeah,
It's been said.
That's St. James.
Great.
and we can maybe just expand it out into some of the areas here, that'd be great, good suggestion, yeah. I get it. All right, what else? So. Oh. Marissa. Self-insured, over which we have zero influence. Yeah, so. Something that, what is it?
What's that leading to? What's your point?
I'm gonna explain, under ERISA, the federal law, there's a very broad preemption provision that preempts all state laws that attempt to deal with the benefits that employers offer, to health benefits and others that employers offer to their employees, which means all of the things that the legislature passes around mandates and trying to make sure that certain conditions are covered or procedures or medications are covered, doesn't apply to that market, which is a big segment of our market. And so
I get that, but what do you want with that?
Oh, to have some authority to regulate those programs, because right now, that's the private insurance market over which we have very little control. We don't even know what are in those contracts. We don't know what the payments are, reimbursement rates are. And we don't know how much the private insurance increases are covering some of the Medicaid costs. So it's like this balance. So we have this little tiny slice. You remember that slice? Well, that's all.
right, so I think the request, as I understand it, would be to maybe narrow the preemption, the state preemption.
Right.
To allow whether it's more transparency or more regulatory authority. I don't know what you want specifically.
Yeah, both, and or both, yeah. So I know that is Hawaii the only state?
Hawaii got grandfathered in before ERISA was, when ERISA was being passed in 1973.
Yeah,
They got their authority grandfathered in, so that's why they have authority that nobody else has.
it does put a significant level of authority in the hands of insurance companies, as compared with, say, a Green Mountain Care Board or with our healthcare oversight.
Right, it's not even, I mean, the extent insurance companies are involved, they're generally as third
That's
party
right.
administrators, they're not really making.
Corporate decision making, right? Which isn't all bad, depending on who's.
No, I
doing it,
think, right, some of
but
it,
it's also a big
some
chunk
of
of
it may be very generous,
yeah,
but you don't know,
we don't know.
because we don't know who they are.
And then, but all we do is hear complaints. That's what I hear. I hear the complaints when things aren't going right. It's like, oh my goodness.
Right, right, I thought
do
I thought you passed this law to
Our
require.
benefits have been changed overnight because somebody got cancer, and that's what we wait. That's not what should happen.
So how do we get out ahead of it? That's.
We ask the federal government, we ask our federal delegation to at least look at it for us. There might be some there might be some things that they can do to help. What I was just talking about. So if someone has an insurance policy that covers certain chronic diseases, and then as a result of too many people in the company having those chronic diseases, and the premium costs are going to go up because they have them. Sometimes they'll just say, well, we'll drop that benefit or we'll lower the benefit. And that's not, we don't have anything to say about that. That may be a good thing for the company, but.
And we don't know, I keep hearing the budget, all that money's going away in 2025.
Yeah.
So we really don't know what money's going away. Does somebody in the JFO?
Are you talking about ARPA?
Are
you talking about federal
I'm
dollars?
talking about federal dollars.
Yeah.
I mean,
yeah.
that's kind of what we're asking right now, is to get ahead of the budget cycle? If we, you know, can they tell us
Yeah,
what money we need that we normally get that we're not gonna get anymore?
they could. I mean, we do know that we're getting money for reimbursement for, you know, workforce retention, for loan repayment, and we know how helpful that has been. It would be nice to see that continued, or at least part of it. We've seen our Medicaid healthcare dollars increase by 62%, and that's helped really stabilize a lot of small independents and others. So yeah, I mean, that's what we're talking about, I think, more than anything else, is that that we've looked at the gaps, we've seen the problems, and now we're trying to see if we can stabilize ourselves going forward. And then other federal rules, laws, or appropriations that can happen that will help. We didn't talk about child care. We didn't talk about long-term care, which is a crisis in the country. But all of our community-based services, we're not unique. It's like, I think the whole country is hurting right now. But, so if we had, I guess the question we might ask our federal delegation, help me with this one if you think it's worthwhile or not, is the control of some of our long-term care and healthcare organizations by private companies that are taking over some of the long-term care facilities. What's happening in
I think the question for you on that is, what would you want the federal government to
I
do
don't know.
about it?
I don't
The
know.
only lever I see still is the labor, it's immigration, it's the staff to support this.
Okay, yeah, no, I'm talking something different. I'm talking about these private companies that go into various states and they purchase all the nursing homes.
Right.
And then
Yes.
they're looking to make money. But we can control that in our
It's
state.
business.
We can control some of that. I think that, again, the
it's
question
problematic.
is A, what would you want the federal government to do? And B, if those companies don't buy the nursing homes, who else will run them?
Yeah. Well,
Yeah, it's a business.
how can we stabilize those very fragile organizations?
Not by taking them over from the government.
No, this is what we don't want. But we do, but what can we do? I mean, if you have a private corporation taking over all of the long-term care facilities, then they'll be charging the cost for the patient will go up like this, and then we're seeing people excluded. So what do you do with all the people who are left out?
I don't know if that cause and effect is real, like, just
I
because.
think we've seen it.
Just,
We've seen it in the state.
I'm sorry to interrupt.
I mean,
I don't know that that's really the source of the problem. Right now, you know, we have a problem in our county,
okay.
the beds available, okay, but there's what I hear is that wings are shut down because they just don't have the labor, they don't have the staff to bring them online, to turn them on. I don't see that as being a corporate issue. That's just a work demographic issue.
It is a demographic, but it's also a pay scale issue. So if you're going into work, yeah, could be. Yeah, it's all mixed up. And we're seeing high turnover.
So what's the solution?
No.
Preventing companies from amalgamating, separate units into, with a common corporate.
Interest?
Yeah.
Yeah.
That's still pretty slow.
If you build it, then they will come. So if we need a forensic facility, what can we do to encourage private investors to buy into something like that? And then the government could manage it. I think we're trying to make government too big.
Yeah.
We're trying to do too many things for too many people. And not where we should go. We gotta figure some way to bring, people into Vermont to invest in facilities. And then what, if they're there and we can provide healthcare, at a livable wage or better, then the people will come there too. I mean, that's what I see in the education community. You can't find teachers. Teachers come here from another state or right out of college, and they can't afford to live here because they can't find a place to live. And if they do, they can't afford it on their wages. So
Yeah.
somehow we
I
gotta,
don't disagree with you.
Right.
No, I don't. The problem is hugely economic. Yeah, it's hugely economic, and housing, all of the things that we've been trying to do. So in terms of the question about having some private organization own and run long-term care facilities, that would be great if it were if patients were equitably treated. So you could get people in who were Medicaid patients. But right now, everybody has to spend down other money to get support, so.
it was like, we had a conversation with a business owner in Rutland County.
Yeah,
And the big thing with him was, I got so many employees, but they can't find childcare. Well, you're a businessman, you know, what are you doing? If you wait for the government to fix the problem, what do the business owners do?
hello.
Yeah, can we get you guys to kind of come to the table and maybe pony up a little bit? That was my message, and
Well, but here's the thing, yeah, no, that's a really good point. So in my district, cars.com, which is a pretty, significant organization, used to have a child care facility, but it was too expensive for them to run. They couldn't keep doing it. So now they don't have it. So now they're looking for help here so that we can, it's just tough, yeah.
Part of that help isn't driving the cost up even further. To me, when we yesterday voted to increase our childcare cost per child by like 65%. That's not gonna help anybody. It's not gonna incentivize.
They'll get workers.
and who's gonna pay for it?
Yeah.
Taxes are gonna have to go up.
Well, we put the $49 million that the governor had in the budget, and then we have our own amount, so it's joint.
If we're gonna get into a conversation about big government, I mean, I just want to point out that the healthiest countries in the world, Japan, Western Europe, Canada, are all big, they're all big government countries. I just have to point that out to folks.
Anyway, so let's go back and look at what we do have here that we can agree on, and then Jen will bring us something that we'll look at. So the issue that I brought up, probably, I don't know what to do about it. So I'm not sure we can resolve that one. Anyway, what do we have so far, Jen, from your perspective?
So the things I have are started with student loans and looking at the federal tax deductibility, expanding financial support to reduce the burden on the healthcare workforce, in part looking at immigration policy, maybe allowing in more healthcare professionals and those who want to work in the healthcare or childcare fields, providing money to states for prevention, intervention, treatment, and recovery for substance use disorder. Also focus on public safety to address the flow of drugs, reevaluate some Schedule I drugs, maybe decriminalize them or look at the research purposes and treating substance use disorder as a disease. Potential for extending some sort of additional Medicaid FMAP, like the 6.2% during COVID, so that we can increase Medicaid reimbursement rates to somewhere in the 100 to 110% of Medicare, particular impact on community systems and independent providers who are being hurt by low reimbursement rates and the vertical integration that results. Public health concerns regarding chemicals, PFAS, PCBs. Maybe there needs to be more scrutiny of chemicals at the federal level before they're put out into the marketplace. If there is for the process around evaluating prescription drugs. Reinforce the Senate education points about money for cleanup and construction, ERISA preemption, greater authority for the states around transparency or regulation or both, and then potentially how to stabilize and support long-term care facilities. Concerns both about corporate ownership and workforce issues, which I think then moves back a bit to your immigration discussion. Am I getting?
Amazing.
Yeah.
You're gonna have to go clean, change your filter.
I mean, one issue with Senator Weeks's point, although I agree with it to a certain extent, is that when you increase the amount of immigration for, doctors, for example, let's just use that example, you can create a problem in other countries, especially developing countries, by creating this brain drain. And I mean, that doesn't sit well with my conscience. Why not?
Depends on which country.
Right, it does depend on which country, but I mean, why not educate and train the folks we have here, which I know wouldn't be an immediate fix.
You can, if you have a labor force available to do that, but with all these incentives, it's still not sufficient. So you have to supplement somehow. It doesn't mean that every immigrant that comes in to support our economic system needs to stay. That it's a permanent move.
Men are green card.
You change the levels of your labor force depending on your labor requirements. And
our sister state, though, could kind of fit into that too. If we pick the right sister state, maybe we could get some people to come and help us out
Back and
here.
forth, yeah.
Yeah. I have two more things. I was reminded about a message from some independent physicians. I'm writing on behalf, this is from Susan Risden of Vermont Health First. I'm writing on behalf of Vermont Health First, physician-owned, 62 physician-owned primary and specialty care practices. Please advocate to the U.S. Department of Education to include physician-owned practices as eligible employers for the Public Service Loan Forgiveness Program. So that's something that we want to put in, because that will help. We have a loan forgiveness program through AHEC that serves for nurses and physicians, and I forget who else we've extended to last year from the ARPA funds. But it would be serve us well to ask for that program, AHEC program, to be reinforced, but also that this one, and this would go to the Agency of Education, can at least see what comes of it. So it'll help us with our loan repayment program. The other one was during the pandemic, telehealth was great, but people need equipment across the board. Broadband expansion is happening. And I don't know if I don't know what the needs are out there right now.
Yeah, I don't know either. It sounded, I think, from testimony in some committee I was listening to that I think QHC and others did a lot of work on that. I think the piece that sounds like it will be going away with the end of the public health emergency is the flexibility on using non-HIPAA compliant connections. And I don't know if
Right, the
there's,
HIPAA Connect, we did talk about that in here.
well, we talked about it because you extended it
Yeah.
for under state law as long as it's allowed under federal law. And I don't honestly know the implications of, so I don't know whether that's something you would want to ask for long-term or whether there are dangers to the patient or provider in not having HIPAA compliant connections.
I think I'd rather ask to have HIPAA compliant infrastructure in place than to say. make-
Yeah, no,
Yeah.
that's actually maybe a good way to say it. That ensure HIPAA compliant technology is readily accessible or something like that.
It's all about money. What about our special needs folks? this gets into special ed, though. I keep thinking about special ed and how poorly funded it is from the federal government. Those are families that really need it.
That's a big one. Mhm.
Did you put that in your education letter? Lauren?
Mm-mm. So it should, I think we should include it.
How would we include it?
I don't know.
And I don't know anything about it,
Oh,
because it's
well,
not.
I know.
not-
Well, I think of the Department of Aging and Independent Living, and that's long-term care, but it's also community service,
Oh, sure,
community
there's
care,
developmental disabilities.
families who have folks with developmental
Right,
disabilities, and that
And that's what it is.
that it does fall into the workforce category or providing some respite.
Mhm.
It all comes out of our Medicaid. Some of it does and some of it doesn't. Let's think about
Is
that.
there anything, I'm just trying to, I'm casting around for things that have been brought to you. I think there were some, thing about home health and some of the Medicare cuts and implications for home health. I don't
Like
know the
visiting
specifics.
nurses and-
Exactly,
yeah.
yeah.
You're talking SASH.
Well, I'm thinking like
Community-based health.
visiting nurses, that kind of
Yes.
home health.
Yes,
And I think there had been some significant cuts you've been hearing about at one point from them for Medicare.
yes,
Um,
increased.
Yeah, so
Yes,
if I
you're
can
right.
check,
Yes.
to check in with
You're right. yeah.
Joel's and then try to articulate it for a draft.
Okay. So we're not saying that everyone gets everything, but what we are saying is that when people need help that is accessible in a way that supports providers, because you can't have pro bono healthcare. Like, how do we do that? You want pro bono,
No,
huh?
that's what I hear.
But it also shouldn't cost a
An arm
fortune.
and a leg. And that's where the balancing comes in between what we have in private insurance and what we can provide in public, through public insurance. And it's just extremely frustrating.
Yes, it is.
Where,
Well, and it's more than frustrating. It can be deadly.
right, okay. Where did I hear this story? Did we hear this story
Oh,
together?
yes, from Dr. Merman the other day.
Yes,
Exactly. That was
that was
so,
horrific.
yeah, and relevant and real world.
Yes.
Yeah.
Yeah. The patient who wouldn't go for care because he wanted to wait for his next year of insurance care deductible and died before he got to the new year. That's what is happening to a lot of people.
It's criminal.
So I don't know whether everybody's ready to say Medicare for all, but at least we can say something about, we've said something about helping us with our reimbursement
Yes.
for our providers.
I'll say Medicare for all.
I don't know these two guys, but.
I don't know about these two, but
Break open the wall.
Not really. There's enough money in the system right now.
yeah.
But you can't do it in a you can't do it in Vermont alone. It's just, we don't have the resources. We could do it more broadly by having some regional cooperation. So maybe maybe that's something to ask the federal government to explore through CMS, how a regional cooperation among states might offer collaboration between public and private insurers for cost-effective, accessible, quality care. Regional work can work.
Can I think out loud?
Yeah,
Yeah,
we're all thinking.
Let's
out
think
loud.
about S5. What I heard from the doctor the other day, I've heard from a lot of people who said that raising fuel costs or requiring people to have electric appliances they can't afford. That's gonna exacerbate that problem because they're gonna give up the prescriptions or food or to heat, to keep themselves warm. And, maybe we can get, and this isn't our lane, but maybe the federal government's gonna have to supplement the money that we get for green projects for,
Ensuring the electricity is available, the infrastructure is laid out.
I mean, they have
Yeah.
all that has implications
Yeah.
on health and welfare.
It certainly
For
does.
sure.
It does. You're right. Yeah.
I don't know how we can put that into a request. And
I
ask.
think everything we're asking of kind of, will help.
Yeah.
The other thing that we haven't mentioned is the prescription drug costs. We have very little regulatory authority over how much prescription drugs cost in this state. And so it's important to me, the little, what do you call the little epinephrine?
The
So,
EpiPen?
EpiPens,
Sure.
I know.
Which I have.
Yeah, I know, I've got family that carry them around, but we can control it by just saying, you're not gonna, that will make sure they don't charge more than X, Y, or Z through our insurance programs. And the same with our insulin coverage, but how do we regulate drug costs for cancer patients? Very expensive.
I have a friend that's a diabetic and he has to do the finger
Right.
sticks and
Yeah.
give himself shots.
Yeah.
He bought, he's on SSI and they gave him the patch that he could take his cell phone and check his blood sugar.
Yeah.
And his health significantly improved because of that. Well, now they've cut back, they won't fund it. I said, you kidding me? I said,
His insurance company? And so it's not Medicare.
no, it is Medicare.
It is Medicare.
SSI.
Right, as soon as they find out they've got a lot of people
Right.
involved, that's just one of the
So-
problems. We have a demographic pressure being put on Medicare, no question about it. And we're, but yeah. All right,
Thanks,
Well,
Jen.
Thank you.
Got
Jeff.
work to do on that.
Yes, we'll see
we
what.
can connect.
together.
Thanks for hanging out with us. It's like,
Yeah.
we're gonna have anything else to do today, right?
You want, I'll give you Susan.
I got it, I was copied on it,
All right,
so that was all.
we can share it around. I think, did everybody get this?
I'm not sure if you did, but I just posted it.
Okay,
So,
Can you
Yeah.
speak to Beth St. James about the education piece?
yes, I
Jen?
will,
Okay, great.
it's in my notes.
and, yeah, this goes through is it the Department of Education at the federal level? Yeah,
I think so, yeah, and it's
Yeah.
AHEC here.
and AHEC does too.
AHEC
And
implements or administers I think the public service loan forgiveness
they don't.
program for Vermont.
Well, this would increase their responsibility.
Potentially, it would expand the universe of eligible practices to
Okay.
participate. I'm not sure how much that would necessarily increase the workload. But I can, if it's helpful, I can reach out to
Liz,
Liz and to
Charles.
sort of separately, but Marilyn
Oh,
Cargill from BSAC to see if there are, I think what I'm understanding your purpose being is to identify federal barriers or federal limitations that affect some of the things that you want to do. So in the workforce
Canada.
expansion, if there are certain things that they're aware of that you may want to put in your letter, I can connect.
Is there any way we can get the federal representatives to come back in?
oh, yeah,
Okay,
we can do that.
sit down with these letters.
We can do that. That'd be fun. Okay, so let's go offline and we'll call it a wrap for